Tonight what we're going to talk about is inflammation first of all. And why inflammation? Well, because inflammation is an essential part of our bodies. It's part of our defense mechanism, but it has far-reaching effects and is involved with so many different diseases. And inflammation can lead to painful syndromes and also cause fatigue. But more importantly, we're going to talk about how treatment can help restore energy and rid us of some of these problems. So we're going to introduce you to the concept of betalains. And what betalains are naturally occurring pigments. There's a whole group of them. There's about 24 that have been described. And they're responsible for that vibrant purple color of the beets. So who's ever eaten beets in the last week or so, you know that you get that purple on your fingers that just won't wash off. That's betalains. And the other thing is, you've eaten betalains before. If you've eaten any kind of food that's got a red color in it, that's betalains. Now, my goal tonight is to take a lot of information, summarize it, and put it into a language that we can all understand. What you do with that information is your responsibility. Because it's up to you to take that information and make decisions that hopefully will affect not only your health, but that of your friends and your family. And any good doctor, their job really is to educate the patient, help you to understand what's going on, and help you make informed decisions that will impact on your own health. And that's a key thing, that message that I'd like to get across to you tonight. And all of you, by the fact that you're here tonight, are educated consumers. You've come here to learn and ask questions and find out the true information. And you didn't come here to listen to me talk tonight, I hope. You came to hear about betalains. And one of the reasons, and Ken's very generous introduction, one of the reasons that I know what I know is because, as Isaac Newton put it, we can see as far as we can because we stand on the shoulders of giants. So I want to quote from Hippocrates, Hippocrates being one of the fathers of modern medicine, or Western medicine, I should say. And what he said was that there are, in a sense, two things in effect. One is to know, and one is to believe we know. To know is science. To believe we know is ignorance. So I'm not going to speculate tonight. I'm going to present to you some science, and again, allow you to come to your own conclusions, to make your own decisions on how you want to affect your health, and work towards what I want to call healthy longevity. And what I mean by that is leading long, pain-free, productive lives well into our advanced years, hopefully with the idea of preventing some of the diseases that up till now we've taken for granted as just something that's going to happen because we're getting older. That's really neat. So we're going to talk about inflammation. And what is it? Well, as I mentioned earlier, it's necessary. We have to have it. And it's going to help us get over that sprained ankle or broken bone or splinter in your finger. Or if some invader comes into your body in the form of an antigen, something that's going to cause an allergy, for example, or an infection, like a bacteria or a virus. You need inflammation to fight those things. It comes in about 3 different kinds. Number 1, there's acute inflammation. So for example, you have an injury. Your body mounts an inflammatory response to heal that injury. That's a good thing. How about if you come in contact with one of those antigens or an allergy? Well, your body needs to fight that, needs to fight the invaders. That too is a good thing. But what happens when inflammation becomes chronic? It doesn't turn off. Well, now inflammation can lead to a whole host of diseases. And that's when things get out of control. That's a bad thing. So I really want you to understand this process. And I'm going to give you an analogy, an example that we can all understand. A little bit related to the race car too, because I just can't get that out of my system. So if you imagine your body, or a system in your body, as a road where there's traffic and things are happening. And it's a busy, busy road. Now all of a sudden, there's a pothole. The road becomes unusable. That system gets disrupted and the traffic has to stop. So what does your body do? Sends out an engineer, the big sign that says inflammation. Blocks the road. Traffic stops. And that's what happens. So that system is done, road's closed. Inflammation. Now the foreman picks up the phone, calls his workies, they come in, bring in the trucks, bring in the tools they need to repair that road. And that's what your body's doing to heal a problem. Well, now the road's all clean, all fixed, everything's ready to go. Foreman comes by, picks up the sign, removes the sign that says inflammation, puts it away, traffic flows. And that's what happens in your body. But what if he forgets to remove the sign? The road's fixed, you still have no traffic. And that's what chronic inflammation is. So this is what's happening in your body. And hopefully that little example of the road analogy will help you understand how that works. So what happens? What are the signs of inflammation? Well, you've all seen this. And, you know, doctors like to speak in long words. So in Latin, the signs of inflammation are rubor, or redness, calor, or heat, dolor, which is pain, and swelling. Those are the signs of inflammation, and you've all experienced those. And the more I've learned, and as Ken said, I've spent a lot of time researching these topics around food supplements, betalains, and so on, the more I've learned is that inflammation really is involved in pretty much every disease. And I've heard some experts actually say that inflammation causes all diseases. Now, I'm not really sure that that's correct, but clearly it is associated with all diseases. Everything from Alzheimer's disease, Parkinson's, neurologic disorders, gastrointestinal problems, cancers, you name it. Inflammation is a part of it. In a few minutes, we're going to talk about arthritis as an example of an inflammatory process. We'll talk about pain. We'll talk about chronic fatigue syndrome. We'll talk about energy. And of course, we're going to talk about betalains because that's what you came here to hear about tonight. Now, being a Western-trained doctor, what did Western medicine teach me? Well, if you've got a problem, you've got a disease, you throw a drug at it. That's what we learn. And you can't deny that some drugs have had dramatic effects on society. A couple of examples, penicillin and insulin, two of the greatest discoveries over the last, well, probably 100 years. But are these really drugs? So how was penicillin invented, or not invented, discovered? Was Sir Alexander Fleming in 1928, who by accident found that a mold growing, when grown in a certain substrate, had antibiotic properties. Isolated that substance, called it penicillin, and that was how the modern antibiotic era was started. In other words, it was nature's solution to, at that point, a life-threatening problem, and it still remains that way today. Well, how about insulin? Another example of one of the remarkable discoveries of this era. In Toronto, if you don't know, it was discovered by Banting and Best in the 20s. It's not even a drug. It's really an isolate of the pancreas. It's a hormone that your body normally produces. They used an animal model to do this, but that was nature's solution to a life-threatening problem. We're going to introduce to you the concept of betalains. Over the last 100 years, two of the major discoveries to treat major problems haven't been drugs at all. And to quote Sir William Osler, who was known as one of the fathers of modern medicine, he actually was a Canadian physician, he was one of the founders of the Johns Hopkins Institute. He said that one of the duties of a physician is to educate the masses not to take medicine. And I believe that that still holds true today, that we too often reach for a drug when a natural product could do the same thing for us. Now, if it were possible to find a natural product that had anti-inflammatory effects and could also help with fatigue and pain, would that not be a medical breakthrough? Well, as I was preparing for this talk, I had my feet up one day and I picked up a journal. It's more of a newspaper that a lot of doctors refer to. It's called the Medical Post. And I read it. And a lot of you have taken this drug. And it's great. It's a wonderful product. I've taken it and will take it again if I need to and I have no other choice. But I'm just going to read a couple of things to you about what drugs can do to us. So in this journal, and this is a real article, this is not made up, it says that NSAIDs, non-steroidal anti-inflammatory, do not treat disease or prevent its progression. They only relieve the symptoms and decrease inflammation for as long as you continue to take it. Isn't that neat? And then in the big box that says warnings, it says that this particular drug, which is a non-steroidal anti-inflammatory, is associated with an increased risk of cardiovascular adverse events, such as heart attack, stroke, or blood clots, and can be fatal. The risk may increase depending on how long you use it. And then it goes on to say that It can promote sodium retention, can cause high blood pressure, and make your congestive heart failure worse. And that they really haven't done any long-term studies on this product. And then one of my favorite parts about it is about the side effects. And it talks about gastritis, erosive gastritis, and dyspepsia, which occur in 25% of the patients that took it. Now, this is just an excerpt, and I'm not saying anything bad about this drug, but this is what we normally do. And we become complacent to the side effects, and we just accept them as, well, that's all we got. So that's an example of drugs. So again, I asked the question, wouldn't it be really cool, wouldn't it be really neat to have a natural product that could work as an anti-inflammatory? I picked multiple sclerosis as a disease to talk about as an example of an inflammatory disease because we don't commonly think of MS as an inflammatory disease. It's a neurologic disorder. It can have devastating consequences, and it is an inflammatory disease. Now, there are genetic components, and we're maybe oversimplifying a little bit, but what it does is it attacks the myelin, and that's the protective covering of the nerves involving your brain and your spinal cord. Well, how do we treat it? We can't cure it. We treat it. We treat it by using two classes of drugs. One are called immunomodulating drugs. In other words, they modulate the immune system. And the other ones are anti-inflammatory. Well, the first group of drugs are designed to try to slow down the progression of the disease. They work on the immune system. They quell or put out the fire of inflammation. The second group of drugs are steroids. Now, not the anabolic steroids that the weightlifters use. These are anti-inflammatory steroids, some of the most powerful drugs we have on the planet. But guess what? They're only poisons with beneficial side effects. They come with a big price to pay. And that's how we treat MS. Finally, there's a group of drugs that are used to treat the symptoms, the fatigue, the spasticity, and the chronic pain that happens in MS. So I asked the question, could it be possible to find a natural product that is anti-inflammatory, that can treat pain, that can help restore energy? Wouldn't that be a medical breakthrough? We're going to shift gears a little bit. We're going to talk about two things. We're going to talk about oxidation and free radicals. And the first question that comes to mind is, what does this have to do with inflammation? Well, inflammation can cause free radicals. Oxidation causes free radicals. How does it do it? Because it causes inflammation. Oxidation causes damage to tissues, damage to cells. And that causes the inflammation, which then can cause free radicals. The two go hand in hand. Inflammation is like a fire that burns within you. Oxidation is like rust. And you've all seen it. If you've seen an apple turn brown, that's oxidation. If you've seen rust on the Tin Man, that's oxidation. Now, why are these free radicals important, and what are they? Well, free radicals are the result of this oxidation. And what happens in oxidation, without boring in with chemistry, is that an electron is transferred from one substance to another. When that happens, free radicals are produced, and free radicals have unpaired electrons. If you remember from high school chemistry, when electrons are paired, that molecule, ion, or substance is stable. If you have an unpaired electron, it becomes highly chemically reactive. Well, what happens in your body? Well, in your body, you have naturally occurring antioxidants that attack or prevent you from damage from these free radicals, but they can't keep up. You need to take in your diet antioxidants to help capture those free radicals. If they're left to wander through your body, a lot of things can happen. If your DNA is damaged by a free radical, it can cause cancer. If your liver is damaged by free radicals, it can potentiate the effects of alcohol and lead to cirrhosis. If you have problems in your blood vessels, you can have stroke, heart attack, or cardiac arrest, or cardiac myocardial infarct, heart attack. I said that already, twice. So you can see how free radicals can have damage in many different places. In fact, even in cigarette smoke, the free radicals can damage one of the enzymes in your body that protects your lungs. If it's damaged, emphysema can result. So it's no wonder that there's been so much interest to find a potent antioxidant that's effective, because its benefits can really be dramatic and widespread. Okay, let's talk about arthritis. Simply put, arthro means joint, itis means inflammation. Arthritis is inflammation of your joints. But it's not one disease. It can be as many as 100 different things. Anything from a mild tendinitis to bursitis to rheumatoid arthritis, which you've all heard of, which can be very crippling, to other systemic diseases like systemic lupus that have widespread problems throughout your body, things like gout, which we don't think of as arthritis, and the commonest form, which is osteoarthritis. Inflammation is involved in all these, itis. Whether it's a cause or effect is another question, and again, a lot of people believe that it's a cause in all forms of arthritis. And what happens? You get redness, you get swelling, you get pain, and you get stiffness because of the swelling. And as a result, decreased function. So, just to make sure everybody's awake, has anybody ever had arthritis? Anybody had a joint pain? Anybody have diagnosed arthritis from a real diagnosis of arthritis? So I see about half of the hands going up, and I think the other half of the people have fallen asleep, so that's okay. All right, let's talk about rheumatoid osteoarthritis. And the reason this is important is because, guess what? We're pretty much all going to get it one way or another. Ken didn't allude to the fact that most people, when think of plastic surgeon, think cosmetics, nip tuck. Yes, I do that kind of work. But I spend most of my time doing reconstructive surgery. Part of that is hand surgery. So I do have a subspecialty training in hand and microsurgery. That means I treat patients with rheumatoid arthritis. I treat patients with osteoarthritis. And I know how devastating these problems can be, especially if they affect the hands. And most people don't know that the commonest joint in the body to get arthritis, in fact, is the basal joint of the thumb, the CMC joint. Well, what happens in arthritis? In rheumatoid arthritis, inflammation of the lining of the joint causes the arthritis. In osteoarthritis, it's degeneration of the cartilage. The joints wear out, they become creaky or cracky and painful when you move the joints. It's uncomfortable. As that progresses, those bones rub against each other, and what happens? Guess what? Inflammation happens again. So as we all hope to achieve that healthy longevity, guess what? Most of us are going to suffer from inflammation. And it intrigues me that there could be a natural product out there that could help protect us against what we have felt to be an inevitable cause of aging. Now, as the disease of osteoarthritis progresses, you've all seen, grandma with the big bony knuckles and things like that. You've seen that? That's because your body's response to that inflammation is to make more bone. And that's what happens in osteoarthritis. Well, how do we treat osteoarthritis? Again, no known cure. All we can do is we can treat the symptoms of osteoarthritis. And how do we treat that? Commonly non-steroidal anti-inflammatories. And clearly, you've heard what they can do to you. There's clear warning saying you can't use them on a chronic basis. The FDA, in fact, recommends strictly against that. And personally, my mom takes Celebrex. Well, Celebrex is a non-steroidal anti-inflammatory. And how does it work? It blocks one of the enzyme pathways in inflammation. And we call that the cyclooxygenase system. COX for short. And you might have heard that. Why is Celebrex a neat drug? It has fewer side effects, particularly related to the stomach and the gastrointestinal problems. But again, you can't use it chronically. Okay, I ask you another question. Could we find a natural product that does the same thing? Along come betalains. In the lab, if you take a tiny little amount of betanin, which is the commonest studied betalain, it actually inhibits the COX-2 pathway by 97%. It's amazing. I couldn't believe it when I read that journal article. But it also affects the COX-1. There's two different types of systems. So for example, aspirin will affect both. Betalains also affect both. They're a partially selective COX-2 inhibitor. So like Celebrex and like aspirin have anti-inflammatory effects in the lab. Really neat. Now, does that mean that it's going to work in us? You can't jump from the lab and say that's definitely going to work in humans, but there was a clinical discovery done. It was an open trial where they gave a beet extract to a group of patients with osteoarthritis. Well, what happened? Without reviewing that study in detail, all the patients, and that was true, all the patients showed a decrease in pain and, as a side effect, had an increase in their energy levels. Pretty neat. So, is this something new that we can take a supplement, a dietary supplement, to treat a problem like arthritis? No, absolutely not. But again, it'd be really amazing if we could find a food extract that has antioxidant properties, anti-inflammatory properties, treats pain, and helps with energy. So I'm going to change hats a little bit, and I'm going to become your family doctor for a minute, because we all need more energy, right? Who can't have more energy? But sometimes the choices that we make may not be the best choices for us. So I'm here to give you a little bit of friendly advice, because there's 3 secrets to healthy longevity. And it all has to do with making a choice of convenience over a choice of common sense. What are those 3 things? Well, number 1, you need a diet which has appropriate nutrients, has appropriate antioxidants we've talked about, has appropriate vitamins and minerals. You got to do that on a daily basis, and it has to be strict. Number 2, you need to find an activity you're passionate about, something that will encourage you to have lifelong participation in an activity. You need to do it. Those 2 are not options. They need to happen. I try every day, but are we perfect? And if we're not, we get to secret number 3, and that is diet supplementation. There's clear evidence that people who supplement their diets do better than those that don't. It's going to be up to you guys to figure out how you want to do that and what you want to do it with, but those are the 3 keys to what I like to call healthy longevity. In the most extreme forms, lack of energy will produce a syndrome called chronic fatigue syndrome. It's been a controversial thing for many years, and nobody really understands it. And it's very hard to study because it comes in so many different varieties and flavors. So what do researchers do? We typically will go to the lab, develop an animal model, and the animal model will help us to understand the mechanisms of action. And you can actually do this in an animal. You can develop a model where they exhibit all the signs and symptoms of chronic fatigue, but more importantly, you can measure biochemical markers of inflammation. And this was done to test the hypothesis, the theory, the thought, the idea, that if you gave an antioxidant to these animals experiencing chronic fatigue, would it make a difference? Well, guess what they found? Not only did it relieve the signs and symptoms, but it also reversed the biochemical markers. Now, can we take that as proof that it's going to happen in all of us? You can't. But it certainly is exciting information, and I don't think it's information that we can avoid or ignore. Moving on, has anybody ever experienced pain? And if you're not putting your hand up, you're totally asleep by now. Okay? So, pain in its most extreme form, again, will form a syndrome called fibromyalgia. Anybody heard of fibromyalgia? You might know people that have fibromyalgia. It's a horrible problem. It affects about 10 million Americans. Translation, probably 1 million Canadians. We're usually about 1/10 of what the Americans have. Except for our currency now, it's pretty good. The hallmark of fibromyalgia is chronic and widespread pain. It's an inflammatory problem. There's problems with fatigue. There's problems with mood. There's problems with anxiety and depression. There's problems with headaches and migraines. Non-restorative sleep and environmental sensitivities. Those all occur in that disease. And until recently, the diagnosis itself was a puzzle to doctors and patients. Very frustrating problem to treat. There's no known cure. There's no known cause. All we know is that it's a chronic inflammatory problem. So it's worth repeating at this point that if you had something like chronic problem like fibromyalgia and you reach for that non-steroidal anti-inflammatory with the known side effects, or a steroid even more potent with known side effects, it's worth repeating that the betalains have COX-2 inhibition, COX-1 inhibition. They work as anti-inflammatories. And again, although there's no proof that they will cure or treat this problem, having a naturally occurring plant-derived food supplement that has these properties is really intriguing for future treatments of these patients. All right, the topic of the night really is betalains. I've got 3 more slides to show you, and this is where I try to not get excited like I can, because like I said at the beginning, speculation can get you into trouble. And I really want to present to you some data. And in tonight's talk, half of you are asleep and half of you are awake, I hope, and the half that are awake anyways. I really can't go through all the data. And literally, I have reviewed about 200 papers on the studies of betalains. Betalains have been around for 30 plus years, used in the food industry, so very well studied. So we can't review everything, but we're going to concentrate on the inflammatory part of it. Now, is this a new idea of using a natural product to treat disease? It's not. We can go back 3,500 years. They used to store their wine, their vinegar, and their water in silver bottles. A natural antibacterial compound, silver. In the 20th century, people put silver coins in their milk to preserve its freshness. You're shaking your head. You've heard that before. It's true. And the idea of using mold on bread, blue mold specifically, was standard practice in folk medicine in the Middle Ages. And in the 1900s, we talked about penicillin in the pancreas, right? So let's turn the clock back a little bit more. Let's go back to the 1500s, maybe a little bit before that. There's a disease called scurvy. You've all heard of it. We don't see it because we eat fresh fruits and vegetables. But it was a horrible disease. Killed millions, literally, of voyagers of the time. And as early as 1500, they knew that if you went to shore and you drank tea made from the white cedar, you could treat scurvy and prevent deaths. They hadn't figured out how to do that on the ships. In the next 300 years, 2 million voyagers were killed by scurvy, or died because of scurvy. 300 years. And imagine how crazy it would have been for a physician at the time to say, all you need to do is eat a lemon a day, or a lime, or some acidic fruit, and you won't get scurvy. Must have sounded crazy. Well, how did they actually figure out what scurvy, how scurvy affected people and how to treat it? It wasn't until an accidental discovery of an animal model to study scurvy. That happened about 1900. It took then 30 more years to find out what vitamin C was until people actually realized what was going on. So history has taught us that if we're looking for the cure for potentially life-threatening problems, which scurvy was of the day, we just need to look to nature. And again, to quote William Osler, the desire to take medicine, perhaps the greatest feature which distinguishes man from animal. You might want to think about that just for a little bit. So, big question, are you ready for a change? Should we be changing the way we're doing things? Well, without a doubt, betalains have exceptional antioxidant activity. So we think of vitamin C or vitamin E as potent antioxidants. In the lab, betalains are 3 to 4 times more potent than them. And this fact alone may prompt some people in the audience to say, you know what, I really have to look at these betalains. Maybe they're better than what I'm doing now. And if you're not doing anything, you really have to rethink that idea. We've talked about the lab studies with the COX-2 inhibition. Question is there any other evidence? Well, I could review a bunch of papers. I'm going to give you just one example. Back to the lab. So when we have to study something, we'll develop a model in a lab. We call that in vivo if we're using an animal. And if you're trying to study inflammation, you can't just pick an animal that just happens to have it by accident. So you have to somehow induce an inflammatory response. So in this particular study that I reviewed, which was published in 2009 in Italy, they gave a substance to an animal that caused pleurisy. Does anybody know what pleurisy is? It's an inflammation of the lung. Now, the neat part about it was that they developed this model that says, okay, if we inject the animals with this and this, they will develop pleurisy. But what happens if we give them a betalain or an antioxidant for a month before and then insult them? And guess what? Their biochemical markers don't change and they don't develop pleurisy. In fact, they found that the betalains were protective of inflammation. Now, it's premature to say that that's going to happen in all of us and to conclude that that's going to be efficacious or that's going to work in humans. However, the data is highly suggestive of the protective effects that a potent antioxidant can have. The question is, could this lead to other effects? And I've had questions before the talk tonight about things like cancer and neurologic diseases and so on. The focus of our topic tonight was inflammation in general and specifically arthritis. The simple answer is yes. In other words, betalains can have multiple effects on multiple different diseases. Last slide for you, and then we'll turn the floor over to Ken. I'm going to explain to you just one more time how inflammation works. And it's my little campfire up top there. So inflammation is like a fire that burns within us. And we've all been out camping, and at the end of the camping, any good Boy Scout will tell you that you need to stamp out that fire and make sure it's completely out. And that's how your body works when it's trying to get rid of a problem. But what happens if you leave a couple of coals smoldering the bottom of the campfire? A couple of days later, you could have a forest fire that destroys the complete forest. You didn't even know that that coal was there. Chronic inflammation does the same thing within our bodies. And I'll refer you to a little article that was in Time magazine in 2004, which is called The Fire Within. And if you haven't seen it, you can get it online. The Fire's Within. Great article, reviews a lot of the stuff I've talked about on how inflammation is associated with so many different problems. So hopefully I've presented a little bit of evidence tonight to you to stimulate questions. Questions about what you're going to do personally, and again with your family and friends, when you leave the door tonight. And hopefully at least I've told you that you need a really good diet and you need to exercise because those are key, and find something you're passionate about because that's important, and do it, hopefully forever. As Spock says, live long and prosper, or work towards that healthy longevity that we all deserve. And I really believe that we've cast enough doubt on what we're doing. So what we're doing is not working. I see it every day in my office, and it's very frustrating. And I see it every day when we walk out on the streets. Let's not repeat what happened with the story like scurvy. Let's not wait for the double-blind, placebo-controlled trials, which the doctors want, before they start something new. Clearly, betalains demonstrate exceptionally antioxidant properties. Clearly, we need those in our diet. And as a result, I really think that antioxidants are one of the secrets to healthy longevity. I really do.
Ladies and gentlemen, a big round of applause for Dr.